Everything you're about to hear was considered good medicine. I want you to picture something. You're 63 years old. You've just left your doctor's office. You feel good. You feel responsible because you're doing everything right. You take your daily aspirin, just like they told you. You rest when your back aches, just like they told you. You watch your blood pressure and aim for that perfect 120/80, just like they told you. You take your calcium supplement every morning, just like they told you. Now I need to ask you something important. What if I told you that in the last 5 to 10 years, quietly, without a press conference, without an announcement on the evening news, the medical establishment reversed nearly every single one of those recommendations? Not because medicine failed, but because medicine evolved and the update never reached you. Here is what happens inside hospitals and medical conferences that most patients never hear. When a major clinical trial comes back with results that contradict decades of standard practice, the guidelines change in the journals. They change in the medical schools. But nobody calls you. Nobody sends a letter. Your prescription just gets quietly renewed. And in the space between what doctors now know and what patients are still doing, people are getting hurt. Not from bad intentions, not from negligence, but from information that expired and was never updated in your hands. Today, that changes. I've spent months going through landmark peer-reviewed trials, the ASPREE trial from the New England Journal of Medicine, the USPSTF guidelines, the WHO early mobilization protocols, and half a dozen more, because I believe you deserve the same information your doctor got. In this video, we're going to go through 8 habits that were once considered not just acceptable, but medically recommended for people over 60. And we're going to look at exactly what the science now says, what the real risks are, and what you should be doing instead. Some of what you're about to hear is going to make you angry. Not at your doctor. Most of them are doing their best with the time they have, but at a system that moves slowly while you are living in real time. Stay with me through all 8 of these, because number 3 is the one that affects the most people, and the damage it causes is the kind that doctors have a specific name for. They call it the frailty spiral. And once it starts, it is very, very hard to stop. But I'll come back to that. Let's start with number 8, and the little white pill that was in almost every medicine cabinet in America. Habit 8, daily baby aspirin. Her name was Dorothy, 71 years old, retired school teacher from Tennessee. Every morning, without fail, Dorothy took her daily baby aspirin. She'd been doing it for 16 years. Her doctor at the time had recommended it. Her friends all took it. It was practically a ritual, as automatic as brushing her teeth. Dorothy believed that little 81-milligram tablet was protecting her heart, and for 16 years, nobody told her otherwise. Until she ended up in the emergency room. Not from a heart attack, but from a gastrointestinal bleed so severe it required a blood transfusion. The ER physician looked at her chart, saw the aspirin, and said words that changed how Dorothy thought about her health forever. "We haven't recommended this for people like you in years." For decades, the logic seemed airtight. Aspirin thins the blood. Thin blood prevents clots. Clots cause heart attacks. Therefore, aspirin prevents heart attacks. Simple, clean, logical. The problem is, that logic was built on data from people who had already had a heart attack or stroke. Nobody properly studied what happened when you gave aspirin to healthy older adults who hadn't had a cardiovascular event. Until 2018. The ASPREE trial, published in the New England Journal of Medicine, followed nearly 20,000 adults over 70 for 5 years. Healthy people, no prior heart attacks, no prior strokes. Half took daily aspirin, half took a placebo. The results stunned researchers. The aspirin group did not have significantly fewer heart attacks. They did not live longer. They did not have better cardiovascular outcomes. But they did have significantly more major bleeding events. Gastrointestinal bleeds, intracranial bleeds, meaning bleeding inside the skull. As you age, the fragile lining of your stomach and small blood vessels becomes thinner and more delicate, like paper that's been folded too many times. Aspirin inhibits platelet function everywhere in your body, including in those thin, fragile vessel walls. In a 35-year-old, the body compensates. In a 72-year-old, it often cannot. By 2022, the U.S. Preventive Services Task Force officially recommended against starting daily aspirin for primary prevention in adults over 60. If you are currently taking daily aspirin and have never had a heart attack or stroke, this is a conversation you need to have with your doctor. Not to panic, not to stop immediately on your own, but to ask the question that the updated guidelines have already answered. Because Dorothy's story didn't have to end in an emergency room. It just needed updated information. And if a tiny 81 milligram tablet that was supposed to protect your heart can betray you this quietly, wait until you hear about habit number 7. This one involves a surgical procedure that millions of seniors undergo every year for knee pain, and what 3 separate randomized controlled trials found when they compared it to a surgery where the surgeon made the incision, looked inside, and then closed it back up without doing anything at all. Habit 7. Arthroscopic knee surgery. I need you to understand something about how medical research works, because what I'm about to tell you will seem impossible until you understand the methodology. In medicine, the gold standard for proving something works is called a randomized controlled trial. One group gets the treatment. The other group gets a placebo, a fake treatment that looks identical. Neither group knows which they received. This works well for pills, but how do you run a placebo-controlled trial for surgery? The answer is both brilliant and deeply unsettling. You perform a sham surgery. The patient is fully prepped, anesthesia, sterile field, a real surgeon. The incisions are made. The surgeon looks inside, and then, without doing anything, closes the patient back up. The patient wakes up believing they had the full procedure. This was done for arthroscopic knee surgery. Not once, not twice, 3 times, in 3 separate, rigorous trials published in the New England Journal of Medicine and the British Medical Journal. The results were identical across all 3 studies. Patients who had the sham surgery, where nothing was done, reported the same pain relief, the same functional improvement, and the same quality of life outcomes as patients who had the real procedure. The surgery performed no better than doing nothing. Raymond, 68 years old, retired contractor from Georgia. His right knee had been aching for 2 years. His surgeon showed him the MRI, pointed to a meniscal tear, said the arthroscopic debridement would clean it out. 45 minutes, outpatient procedure. Raymond felt some relief in the first few weeks, likely from the anesthesia and reduced activity. But by month 3, the pain had returned, and something else had changed. The mandatory rest period following surgery had caused significant muscle loss in his quadriceps. His balance was compromised. His surgeon recommended a total knee replacement. Raymond went from a manageable ache to a trajectory toward major surgery in under 6 months. Most degenerative knee pain in seniors isn't caused by loose bits floating in the joint. It's caused by deep structural cartilage changes. The slow, progressive wear of a joint that has carried a body for 7 decades. Arthroscopy cannot reverse that. It cannot regrow cartilage. What it can do is trigger inflammation, force immobility, and in older adults, that immobility carries a cost the consent form rarely quantifies. I've told you about a pill that was supposed to prevent death and didn't. A surgery that performed no better than doing nothing. But habit number 6 is different. This one isn't about a medication or a procedure. This one is something your doctor, your family, and every well-meaning person around you has almost certainly told you to do. If you've ever been sick, ever been in a hospital, you've heard these words. You need to rest. Just take it easy. Those 4 words may be the most quietly destructive advice ever given to a person over 65. Habit 6. Bed rest for recovery. It looks like healing. It feels responsible. But inside that body, something is being destroyed. The medical term is hospital-associated sarcopenia, and it is one of the most underreported, underdiscussed crises in senior healthcare today. In a healthy 25-year-old, 5 days of complete bed rest causes measurable muscle loss. The body compensates. They get up. Within weeks, the muscle rebuilds. In a person over 65, the same 5 days of bed rest causes a 10% loss of muscle mass, primarily in the legs. And here is the part that changes everything. That muscle does not come back. Not fully, not easily, and in many cases, not at all. There is a biological reason for this. It's called anabolic resistance. In younger adults, the body responds to protein and movement by rapidly rebuilding muscle tissue. The anabolic signals work. In adults over 65, those signals are blunted. The muscle protein synthesis pathway doesn't respond the same way. Muscle loss during a week of bed rest at 70 is not equivalent to muscle lost at 35. At 70, you may never fully recover what you lost in that bed. Margaret, 73 years old, active woman, walked 2 miles every day. She had a minor respiratory infection, enough to feel genuinely unwell. Her family encouraged her to stay in bed. She did. For 8 days. When Margaret got up, her legs felt weak. She assumed it was normal post-illness fatigue. She'd be back to her walks within the week. She never walked 2 miles again. Not because the infection damaged her, but because 8 days of bed rest had cost her the foundational muscle she needed to walk at that pace. She'd entered what geriatricians now call the frailty spiral. The frailty spiral works like this. Muscle loss leads to reduced activity. Reduced activity leads to more muscle loss. More muscle loss leads to balance problems. Balance problems lead to falls. Falls lead to more bed rest, and the spiral tightens. This is why the World Health Organization and the American Heart Association now push for early mobilization, meaning movement begins not days after illness or surgery, but hours. Patients who have had cardiac events are now walked within 24 hours. Hip replacement patients stand on the day of surgery. This isn't cruelty. This is the science of preserving the one thing that determines independence. If you are over 60 and you are sick, rest is necessary. But here is the critical difference. Rest means sleep and reduced exertion. It does not mean complete stillness. Even getting up to walk to the bathroom. Even standing for 5 minutes every 2 hours. Even gentle, seated leg movements in bed. These signals tell your muscles, you are still needed. Habit number 5 is different. Because this one isn't just ineffective. When done wrong, it can actually harden your arteries. Habit 5. Calcium and vitamin supplements. For the last 30 years, the advice for women over 60 has been nearly universal. Take your calcium. Take your vitamin D. Protect your bones. It was handed out in every gynecologist's office. The logic was undeniable. Bones are made of calcium. Older women lose calcium, therefore supplement calcium. Simple, obvious, responsible. In 2018, the United States Preventive Services Task Force completed its review of the evidence. Their conclusion was one of the most quietly explosive reversals in modern preventive medicine. There is insufficient evidence that calcium and vitamin D supplements prevent fractures in healthy seniors. Not they don't work well enough. Insufficient evidence that they work at all for fracture prevention in otherwise healthy community living adults. Meet a concept called nutrient delivery dysfunction. When you swallow a calcium supplement, your body has to decide where to put it. In a young, hormonally balanced body with active bones and sufficient vitamin K2, calcium is directed into the bone matrix. That's the goal. But in an older body, particularly one not doing regular weight-bearing exercise and low in vitamin K2, the calcium does not go to the bone. It goes to the bloodstream. And then, it deposits. Not in your skeleton, in your arteries. This process, called vascular calcification, is the hardening of arterial walls. The same process that underlies atherosclerosis. The same process that stiffens vessels, raises blood pressure, and increases the risk of heart attack and stroke. The supplement prescribed to protect your bones, in the wrong conditions, can contribute to hardening your arteries. Carol, 67, from Ohio, had been taking 1,200 milligrams of calcium daily for 11 years. At a routine cardiovascular screening, her cardiologist found significant arterial calcification, unusual for her age. When they reviewed her supplement history, the calcium dosage stood out immediately. She had been faithfully doing the one thing she'd been told would keep her strong, and it had been quietly calcifying the walls of her blood vessels for over a decade. Carol never knew, because nobody told her the guidelines had changed. What the current science supports for bone health after 60. Weight-bearing exercise creates the mechanical stress that signals the body to use calcium in bones. Vitamin K2, found in fermented foods and specific supplements, acts as the traffic director routing calcium into bone and away from arteries. Most calcium supplements do not contain K2. Most doctors don't mention K2. And dietary calcium from food is absorbed more gradually and safely than the bolus doses in supplements. But I need you to prepare yourself for habit number 4, because this one involves something that senior men are almost never warned about. It's about your weight. And what I'm about to tell you directly contradicts almost everything the health industry has told you for 50 years. Habit 4. Aggressive weight loss after 65.